Hey guys, it's Jana Price, and welcome back to another episode of Nurse Converse. I am super excited today to have three lovely ladies joining us, two nurses and one in the healthcare industry. And they have come up with an answer that we've all been looking for I need to do something different in nursing. I love being a nurse, but I need a change. And they showed up and they are bringing us the answer. So I want to hop in and let's get started. Let's introduce these lovely gals to you and let's hear about their amazing business, Nurse Connect, which is going to be the answer that all of us nurses, no matter what part of nursing you're in, this could be the answer for you. So welcome to the show, gals. Thanks for coming on.
Thanks for having
us. Excited to be here.
Absolutely. So let's start out. I want to hear a little bit of history about why we got here. And I know you guys are excited to hear this amazing answer that I've just taunted and telling you I might have solved every single problem you have been looking for as a nurse, but which, this is going to be a big help. But you guys need to know the story why, because it's going to resonate. It's going to really make you appreciate what these gals did to bring something different with you. So, Jackie, let's start out with you. Tell us your why of why you got involved.
Well, it really all started after I had my daughter, and I was like, I don't know if I could commit to 12-hour shifts and weekends and holidays. Like, I have this baby, and what other options are there for nurses that aren't like shift work? And for me and my family, we chose for me to like step back a little bit with nursing, but I always still wanted to be a nurse. I just like didn't know how to go about it and balance it all. So I wasn't a good position in that I was still able to be a nurse for patients at home going through fertility to do their injections. How did I get that gig? So many people are like hearing nurses that have gigs like this, and they're like, but how did you get that? And I was fortunate that I had a network that kind of brought me patients that were in my area. Most nurses don't have that network. And no. It was really great for me to be able to be home and like still make a little bit of money, still use nursing, but still also be a mother. And I was talking to my husband and I was like, I wish I could do this more. I just need to find like the place to go that can like connect me with more patients that aren't in my network. And we both like dove pretty deep, like trying to find essentially the TaskRabbit for nursing. Like, where can I go to put myself out there to grab patients, like to get more of these like gigs? And there was nothing, nowhere to go. And I was like, do I just create this? Like, I've never had a business, ran a business, started a business, but I knew that I wanted this and needed this. I knew other nurses wanted and needed this. I knew patients needed this, like this access directly. And that's when I started really talking about it, writing things down and reaching out to other nurses. I knew I needed a partner in this who was a nurse, who understood. And that's when I contacted Kat. We went to nursing school together. We worked our first jobs together. We did night shifts, weekends, holidays all together. And we stayed friends even when we hopped around to different like departments and companies. Kat went across the country. That's a whole nother story. But she completely signed on immediately because she had her use case, obviously, as a nurse, being that she wanted to do this, but also with her family struggling to find care. She'll talk about that, I'm sure. And she was like, we need this. So we came together, we surveyed nurses, we surveyed patients that we knew, and the answer was that we needed this. So we wanted somebody who had that like business backbone, right? Like who was in the industry. And luckily, by chance, the universe brought me into conversation with Amanda, who happens to be my cousin through marriage. And that's how our team kind of started. And we've come such a long way, and we're so excited to like get into like where we're at today, from just the idea of this TaskRabbit in nursing, to, be that place for nurses to go to that want flexibility, independence, side gigs, or even their own business. I think most nurses will probably use this as just like an extra way to create income for themselves without, starting a cookbook or, doing real estate or I don't know, just completely changing careers, which is kind of scary because you hear most nurses 40% about are going to leave the profession by 2030. So it's like, we need nurses to stay here. I was one of those nurses. I was like trying to find a new profession. I was like, I can't do this. And I'm so happy we're here today to like bring this to the table for everybody.
That's amazing. And so, well, Jackie and Kat, I want to hear from you too, but Amanda, so you've got these two nurses that are coming to you. You're not a nurse, but you hear their problems, you hear the issues, and they present this. What was your thought?
So my first thought when Jackie brought it to me, I was like, what do you mean this doesn't exist? Like, it has to be. So like we started Googling things. She's like, trust me, I've done this all. It does not exist. We have to do it. I'm like, all right, so let's bring it to life. She's like, yeah, but how? And I was like, well, step one, we just started going through things and what things we would have to do to really turn it into a business. And, my background is in healthcare, but more on the operations side. So this was so exciting to me because that's what I love to do, right? Have an idea and kind of bring it to life. My motto is always, there's got to be a better way, smarter, not harder. So I was like so excited to jump on board when Jackie brought this to me. And I think it scared her how easy I made it sound, but she was like, so we can really do it? I was like, yeah, let's start tomorrow. Sure. So
I love that. That's amazing. Now, Kat, you are a nurse and you're also an MBA candidate. So tell us about how this idea and working with Jackie and Amanda, tell us a little bit more about that.
I mean, when Jackie came to me with this idea of like, hey, would you want to like be involved in trying to create a space where nurses could come and work independently for people in their area that need care? I was like, absolutely. One, because I'm the type of person I've always wanted a side hustle. I always wanted a side gig since day one of nursing. Like, I'm someone that on my days off, I needed to be doing something, but holding down a second job when you're a nurse is one, just it's so much. It's so hard. And two, with the schedule that you live and work by, it's almost impossible. I couldn't even make a gym class weekly, let alone hold another job. So this idea of like being able to work for myself kind of, and only work when and where I wanted to, was really appealing to me. And I know Jackie started to touch on it, but I was watching my own family struggle with trying to find care for my grandma who had a stroke and is blind, living on her own, and really still wanting the independence of being by herself, but also really needing someone there every morning to help her open her pill bottles. And I watched my parents struggle to find that person because agencies, as great as they are for so many reasons, there are restrictions on the amount of hours a nurse might have to be in the home, or, what might come through Medicare and Medicaid is going to, again, follow like a set of guidelines. Whereas the nurse down the street, I'm sure that she would happily stop by for 20 minutes for $50 if she knew that you needed her. So it was really like one of those combinations and this serendipitous timing when Jackie contacted me because she had no idea I was in business school. But I did. I had gone back to business school. I wanted to expand my nursing career but didn't quite know how. And the idea of creating this online marketplace where nurses can come and create their own profiles and now be given tools to like find patients, schedule patients, be paid by patients, all while not actually having to work for anyone else, has really been something that's been really awesome and fulfilling to create.
That's awesome. Okay, now I know I've gotten the attention of a lot of people out there. That's the whole reason I wanted to tell you. So many people's stories are the same. They're looking for what you wanted, what you guys said. There is a need, and there has to be a way to fill it. So, if you guys are thinking, wait a second, this is kind of like a Facebook marketplace meets an Uber meets a TaskRabbit, you'd be correct. This is really, really an awesome idea. And here's where we're going to start breaking it down. You're going, wait a second. So they've created this platform, Nurse Connect, where I can go and find jobs that people are going to pay me for, patients for what I know how to do that the hospital's paying me for. You're like, wait a second, how does that work? Well, where do I get the patients from? So let's start breaking that down. Let's say that I am a nurse. I am right now, I do know that you guys are live in New York and in Florida. So if we're going to have instructions, but if you're in another state, don't go away, because we're going to tell you they're coming live everywhere and you want to get on the boat first. But hang with us here for a second, because right now, if you're in New York or in Florida, you can simply go to Nurse Connect and you're going to fill out a profile, what you do, what you charge. You're like, okay, well, this is easy. If you build it, they will come, because they're going to have patients who are looking for what you offer and they're looking for a rate. And you're essentially going to say, this is what I offer. They can go and you can provide them services. And here's the best part. Actually, I'm not going to tell you the best part. I'm going to let them tell you. I want them to tell you because it's so good. But so, Kat, fill us in a little bit. If we go on, you're in New York and you fill out a profile, like we said, how does the patient find you? Give us a little bit more detail about that.
Yeah, absolutely. So say I've just created my profile on Nurse Connect and I get verified and onboard and everything like that on the back end. Ways that people are going to find me is kind of threefold. One, I'm given a unique URL that I can share. So it's nurseconnectnow.com and my own name. So I'm in Facebook groups myself of, home healthcare in New York City, which is where I'm based. And I can see someone in there posting, asking for care, and I can copy and paste my link. And instead of now having to DM them or give them my cell phone number or deal with personal information out there, I link them directly to my Nurse Connect page, which is secure for messaging, helping keep my safety and privacy all in one place, gathering their information. So that's the first way. The second way is we have a job board on our site where people who are looking for care, the same way that they're posting or texting their friends, can post their care needs. So you can hop onto the website and you might see so-and-so is looking for someone to come and help them recover from surgery. Thirdly, we are always marketing. We have a lot of partnerships with different providers and practices and affiliations to help bring patients to our network so that our nurses can find the gigs that they want. But really, when you're a patient and you go to nurseconnectnow.com, you get to enter your zip code and or the type of care you might be looking for, and nurses in their area, meaning the patient, are going to filter. So Joe Schmo down the street from me is going to type in the zip code and I'm going to populate. And then they'll have the ability to, again, message me through a private secure chat that keeps everyone's phone numbers hidden, ask about inquiries about what I can do, rates, everything like that. And the best part about it is, as the nurse, it is fully up to you if you're going to accept or decline that job. Nurse Connect is not telling you, oh, someone needs you, you have to go now. This is independent. It's work as you want, when you want. So it really gives you that ability to match and take on the gigs that you want.
That is, wow. When I was leaving bedside 3 years ago, I wish this option was out there, because it may have kept me in a little bit longer, knowing that I could still nurse and I'm going to call the shots. That is the coolest part. And Jackie, here's a question for you. So let's say that a nurse is out there and they've only ever worked labor and delivery, but they're comfortable. They can give some meds. They can give an injection. Or let's say that there's a CNA out there. Do we have to be a nurse? Let's talk about who can join Nurse Connect and what the scope of practice looks like for that.
So we say nurse really to cover anyone who practices as a home health aide, CNA, an LPN, an RN, or an NP across all types of departments and experiences. Because at the end of the day, it's really up to the patient who they want to work with also. Like, the nurse gets to pick if they want to accept the job, but it's also like the ability for the patient to kind of choose who they want, what they can afford, when they need it, like who's going to come to them. So you may have a nurse who's got 1 year, let's say, of bedside experience, and they only have L&D as their experience. And then you have a nurse on there who has 30 years of experience, 12 years in ICU, 10 years in the ER, the list goes on. Their rate might be a little higher because of all their experience and their years in nursing. And the nurse with the 1 year of bedside may have a lower rate. And at the end of the day, it's what can the patient afford and what are they comfortable with? But 1 year, everybody knows how to do an injection medication if that's really what it's, what they're being called for. But that's why it offers such flexibility. Like wherever you are as a nurse or a healthcare provider, we have a spot for you because there are millions upon millions of patients who need the access to care, and they will pick and choose who fits for them just as much as a nurse will pick and choose what fits for them. And this marketplace didn't exist before today, actually last year, but yeah.
I think adding on to what Jackie was kind of saying too, how we have it open to kind of all realms of nursing care. And I know something that I really questioned when she first came to me with this idea was I was like, am I allowed to do this? And the answer is absolutely yes. So as you mentioned before, Jana, you're like, let's talk scope of practice, right? So whether you are a nurse or an NP or a CNA, you have a certain guideline that you can work under and a scope of practice that you can work within. And it's ultimately up to the individual to stay true to the standards of their certifications and their licensing when going out and doing home care. But I think like one of the most eye-opening things for me as I've built this business as well as been a nurse on this platform is everything I'm asked to do is being assigned to this patient to do for themselves. So I'm allowed to do it. Granted, I'm a nurse, so I can do things like administer medication, and there are certain professions in nursing that might not be able to do that. But for example, I've been asked to help recover from a surgery before, and this patient had to give themselves heparin injections. And they have never given themselves an injection before, but that's their assignment from their doctor. These are patient instructions, patient prescriptions, so it's absolutely okay for a nurse to step in and do something that the patient would otherwise being told to do to themselves, which I think is really cool because it's just a way that nurses can offer that support and kind of care that a lot of times, unfortunately, when you're in the hospital, you just don't have time to like really give that compassion and empathy that a lot of us, that's the reason we became nurses. So I think when covering like scope and independence and all that, you have to stay true to what you're legally allowed to do. We offer resources on Nurse Connect to help, people find what their state laws might be and things like that. But it really is this eye-opening experience that so many people are sent home and told to provide themselves with all these care tasks that we at least went to school for and feel a little bit more comfortable doing than they might.
Right. I think that, and you guys do verify their licenses, right? Like
Absolutely.
Once you come on, you do have to verify the license. So, you're covered there. And then you guys do provide links for insurance for nurses, right? For practice insurance. So I believe there's options that you provide. They can just say, hey, I don't have any practice insurance. You provide those resources. Say, hey, you want an extra layer of coverage? Here's a link to do that. So I believe that we're all nurses. We know what our practice standards are in our state. Like you said, if you don't, we'll provide you the links to do so. And we'll also provide you a link to have a little bit of extra coverage. So when we're looking at scope, I know that's a huge question that I had asking you guys. I feel like you're covered there. And here's something. If it's something you in the hospital, we're always told, or at the bedside clinic, if you don't feel comfortable, ask a question. Well, here's, if you don't feel comfortable, you don't have to do it.
Exactly.
And we have help, like we have a help team. So if the nurse ever does have a question, they can immediately ask someone on the site. And there's always the ability to anonymously report someone if, say, you are being asked to do something that you're not comfortable with. I don't know if we want to keep that in there. I don't know.
Yeah, no, that's amazing. That I think it's amazing. You guys have really thought about this and covered it from the top to the bottom. I mean, it's really, you can tell that this was designed by two nurses and somebody on the tech end, because it's a great idea. And I do have, so here's what I'm thinking that people are want to know. Okay, so they come to Nurse Connect, they sign up, they get their profile. You guys will verify their license, and they're going to profile, and they're going to fill out all of their what they want to do. Can you make a list of what you want to do? Like, as far as, can you provide your services, as in they can click on what they want to do, or when they're coming out, are they specifically, how do they filter for the nurses to find out what they want?
When the nurse creates her profile or his profile, as well as when the patient searches for a nurse, there's filtering capabilities. So when I'm building my profile, I'm going to mark off things that I do or don't do. For instance, I personally haven't had a lot of experience with pediatric care, so I don't select pediatric care when building my profile. The same way that if a patient were coming and looking strictly for postpartum support, they would be able to click postpartum support, and people that only provide elder care won't come up. So from the get-go, we really work to kind of narrow down so that people are, not wasting time per se, but we're not just out into the abyss throwing these requests or matching with these patients, but rather, really trying to set it up so that who the nurse and who the patient are work together, and it just makes sense. The system is very tedious, it's very complicated. Getting home health care can be such a process, and we're just trying to do everything we can to shorten that process, to make it more flexible, make it more accessible.
We're here to close a certain type of gap, right? We're not in competition with other home healthcare agencies, concierge services. Those are great and they're needed, but it just shows that there's more that's missing. And that is what Nurse Connect is providing, right? Direct access. You already know you're not getting covered for the care you need. You already know you don't want to lock yourself into the requirements of 8 hours or 12 hours of care when you need 20 minutes. And nurses finally have a place where they can take their experiences and create a side income or even a full income doing this, which creates extreme flexibility, more independence, maybe less burnout. I mean, if you could decrease shift work or not completely change careers or have the options to just make more money without overtime, like, this is the place to go. So on both sides, it's access, and that's really it.
Right. In talking about this, something that came up, and I think that you're just opening so many doors. Let's say that a family has a medically complex child, and they want to go out and do something for a few hours, and they don't necessarily need full-time care, but it's hard to just leave a child who might have some medically complex issues with just anybody. You, as a nurse, you're a pediatric nurse, you deal with medically complex children, you go on, these families can come on and say, this nurse has 5+ years working with medically complex children, G-tubes, or, they might have some kind of allergy. They can come on and hire you for your nursing expertise experience, go out for a few hours, a day, knowing that at home they have a registered, licensed nurse with experience that they've met taking care of their child. And this is not, you're still using your skills, but you're not bound to charting. You're not bound to all of the paperwork that comes behind it. You're simply using what you went to school for. You're simply using your 5 years of taking care of these children to go and elevate your skill. I mean, I hate to say brand because we're not a brand, but we are. You're taking yourself and you're saying, I'm good at what I do. I've trained at what I do, and I'm here to provide you a service so that you can go and do something you like to do. Like you say, you want to have a shot. You need somebody to come over because let's say you're going through IVF and maybe your husband's out of town. You don't feel comfortable. You go on there and you find a nurse who's has some experience, and hey, can you pop over? I'll pay you, X amount of dollars to just give them a shot. And then, you schedule it in before you go have drinks with your friends. I mean, this is a great way to use your nursing skills, which we all know we have worked so hard for, and they are so invaluable. And
Absolutely.
to me, this not only shows nurses how valuable you are, you're building something in your community that can build trust in your community. What you're going is saying, hey, we have these nurses that we've vetted, that we know have licenses. This is what they've got. You get a freedom to look on through these nurses and handpick the nurse that you feel most comfortable to take care of you. Where are you going to find that anywhere else? I mean, what a great and awesome model, not only for the nurses, but for the community. So if you guys have any thoughts on that, because I kind of feel like, to me, it seems like, yes, this is such a no-brainer, but you guys, you did it. It should have been happening a long time ago. But
yeah, I think that's exactly it, right? So all the Facebook groups in the local communities, that's where all these conversations are happening. So that's where we're like, we need to step outside of just building profiles and getting the nurses out there, but we need to bring the communities to us, right? Give them a space where they can post their needs and then the nurses can see it in real time. So that's a huge area for us that we're focusing on. So we can bring those communities to somewhere that's outside of social media and Facebook, right?
Absolutely.
Especially when those get overlooked or people aren't even responding. And they don't even have the tools that we're providing on our platform to give them, even more access. You're not just like handling one Facebook post. You probably want more than one patient. And that's what we're trying to provide. And we're not hiding behind the technology. Like, we are technically a technology company, but we are so active we do onboarding calls. You want to talk to myself or Kat. We are out there in our communities talking to medical offices, private practices, ambulatory surgery centers, clinics. When they hear we're nurses and we're doing this, they go from like arms crossed to like arms wide open. They're like, wow, okay, great. Give me everything you have. We have patients who want this and need this all the time. And it's just been like so eye-opening and so exciting. And that's why we're just so excited to like get who we are out there, get Nurse Connect out there, and get people like going independent.
Absolutely. And like you said, you're not in competition with home health. We already know, I have many friends who work in all sorts of areas of nursing. There's not enough nurses right now who want to work home health. And there is a shortage. People are leaving because of the burdens, because of what it requires. You've actually come in and you said, hey, listen, we know we've got burnout on the nursing end. We've got the shortage on the community side. What we're offering is a chance for you to come in and provide your skills, let them see it's not a full-time thing. You could make it full-time if you wanted to once you build that clientele, but we're giving you the opportunity to work as little or as much as you want. So essentially, you're kind of really helping these nurses build their own business. This is really taking, because nurses can do everything. Let's just go ahead and say it. Whatever it is, I am fully convinced nurses can do everything.
I can attest to that. Working with these two, I can attest to that. That's for sure.
If you have worked in a hospital, anything dealing with people and patients and all the things, clerical, technical, why not? Let's just go ahead and make a business of it too. So you guys have stepped in and given them the tools to do that. And this is the part I've been waiting for, and the most exciting part to me, because I know we're all looking for the money. How much does it cost the nurse to do this?
Okay, so making a profile on Nurse Connect is absolutely free. There's no cost to signing up. We check your license on the back end. There's no harm in creating a profile. And when it comes to setting your rate and what the patient is going to pay you, one, that's up to you to determine. And if you're like, well, I have no idea what I should be getting paid for my services, don't worry. We already also built you a resource guide on how to determine that, how to calculate that out. You're always also, there's that option, again, I said to ask for help via the website and do a chat. But everything you ask for in your rate goes straight to your pocket. So if I'm a nurse and I say, well, I charge $100 to administer an injection, then I walk away from that appointment with $100 directly in my bank account, paid directly through the Nurse Connect platform. zipped, ready to go. There's no, oh, I'll pay you cash tomorrow, or, oh, well, you said this one day and now we're this. It's set, it's in your pocket. And we at Nurse Connect aren't taking a penny of that, because I think all nurses can say that they are sick of losing money to agencies, administrators, hiring companies, whatever it is. You're the one doing the work. We believe and stand by. You should be the one getting paid. The patient is responsible for a small transaction fee, but again, that's not going to be taken away from the nurse ever on our platform.
So you guys hear that, right? I hope everybody out there is hearing that. Just to reiterate, it's not going to be agency. You are walking away with 100% of what you are worth, which when they told me this, I had to just take a double take. I was thinking, no, this isn't right. And I let them talk even further, and I was waiting for the fine print and the little red lines and all the things. And when I went to sign up on the site, I wanted to see for it myself. Everything they're saying is true. It is so simple that you simply go on, you make a profile, you enter in your bank information, and then you can put what you want, what your rate is. And once you've completed the job, you're getting paid 100% of what you just did. So let that sink in, because if you were even questioning joining Nurse Connect, why would you not? It's even if you can hop on there, make a profile, and just put your stuff on there. And if it happens to work out that you, which we should probably say, scheduling, you just put your hours that you're available, right? It's not like you said, you don't have to be available for 24/7. You work your 3/12s, and then you decide on Friday, you're trying to save up to go on a trip. So every Friday you allot yourself 6 hours, and in those 6 hours, you pick up a little extra cash and you get to decide where. It truly is that simple. Now, am I missing anything? Is there anything you want to add that the nurses need to know, or even the patients that may want to hop on? We definitely want to
I would just highlight that the flexibility of the calendar is so important, because you could change your schedule every week, right? And we know nurses' schedules change every week, so they could set it to whatever they want open for the week prior.
I mean, how can you beat that? And in thinking about this is really important. And this is something, as I have a parent who's aging, and I travel quite a bit. As a nurse, I think about, if I'm not there and something happens and my mom needs care, as a nurse, how comforting would it be that I could go and I can pick the care that my mom is going to get? So we as nurses, what a great site that we can tell other people or patients about, hey, listen, you could probably get on here. I'll show you some recommendations. If you know you've got a family member in that state, say they're out of state. Hey, I know that you're going to need some post-surgical care. Let's hop on. You've got this amount of money. Let's get this nurse to come by. As a nurse, healthcare provider myself, what a great comfort knowing that I know exactly what kind of nurse that my mom is about to get. So that's just another something for you guys out there who are listening to think about. This is not only for you to make some money, but to also pick the care for your loved ones.
I was just going to say, touching on that, Jana, I actually had a real personal experience with that. I had a few friends have children recently, and luckily they live within a few blocks of me. And one of them went through a bit of a traumatic C-section. And, I remember her saying I don't know, is my incision okay? Is my scar okay? All those sorts of things. And I'm her friend and her nurse, and I'm right here. So she had that ability and that comfort, and I could come over and assess with the skills I have and, provide a voice for her before that 6-week appointment. That is crazy. That's a different topic we can go on. But anyway, but then I have a friend who lives across the country, and she didn't have that. And I was like, my heart broke for her, because she was in such anxiety and struggle. And she was like, how am I supposed to wait? What does this look like? And it's just, I think knowing that we're bringing access to nurses to, like you said, to our loved ones, to our friends, to our neighbors, is something that, not to get woo-woo, but it can just make you sit at home a little happier at night that, you're expanding care to individuals who don't necessarily have a nurse to text.
Yeah, and I think everybody has a relatable story when it comes to this, right? So I think anybody who's listening right now is probably like, oh, wait, there's a time where I could have really used Nurse Connect, right? So,
Absolutely.
Yeah.
Without
Well,
a doubt.
listen, personally, like as an L&D nurse, I was literally showing every mother out there how to breastfeed. And at the time, I didn't have kids of my own, but I was trained and teaching these women how to pump, whether they were pumping or they were breastfeeding or formula feeding, whatever the case may be. And then I became a mother and I was like, I'm going to breastfeed. And it was during COVID times where nobody was coming to the house for anything really. And it was not going well. And I was like, but I know this, I've taught this. And when it was me and I was like, this is so hard and I don't think I'm doing it right and something's off. And I happened to come across like a story of a girl that I knew on Instagram who had her like certification in lactation. And I cold messaged her like, can you please help me? And paid her to video call with me to go over it. But imagine I could pay somebody who is trained in that to come to my house and physically rearrange what's going on and like really guide me, even if it's one time or two times.
Yeah.
It's very
and even
personalized,
Jackie,
customized. Yeah.
imagine you had that resource. So we would have taken 3 days of you crying and worrying and being like, do I message this stranger? Do I not? Because now you're just like, wait, I'll go to Nurse Connect. I'll find someone that knows how to do this. Like, we're eliminating that anxiety of like, who do I ask? Where do I go? Like, do I broadcast this on Facebook? No. We've created the space for you.
And a lot of times you're not.
Yeah.
Right. Exactly. Now that brings up a really good question too, because I know some people are thinking it's on the patient side and on the nurse side. If they wanted to, can they chat with their nurse before they come to give them care? Can we get a little meet and greet for a few moments ahead of time?
Absolutely. So we have a secure messaging system built right into our platform. So both the nurse and patient are notified via email and or their phone that they've received a new message, appointment request on the platform. And then there becomes that secure messaging, kind of like, I don't know, I might age myself now, but like an AIM chat system or, any of your, I guess now, like kind of bot systems where you're talking to someone via a website, but they don't have your personal phone number and you don't have their personal phone number, anything like that. And it's, monitored in the sense that if there was something that was off, you can always report, reject, all those sorts of things. So absolutely, like, you have the ability to message, and then we encourage, if you want to take it further than just messaging before attending an appointment, you can absolutely video call with them on your own or set up a meet and greet phone call. But we're 3 females, so it's in our core to be on the alert of safety, and that's something that's been built into Nurse Connect. Making sure that we have a system to know where our nurses are. A patient has to provide their location. They have to provide a credit card, the same way that our nurses have to provide a license. So we really are always kind of thinking of more ways to allow safe interactions via our site, so that, our nurses don't have to be afraid to go to work.
I mean, absolutely.
We are hoping on having video technology in the near future as well. So
that's amazing. You guys have it all covered. So that brings us to where I kind of want to talk about, how do you think this will shape? I have no idea that this is going to go well off the ground and do so well. So how do you envision this shaping nursing culture in the future? And Jackie, go ahead and give us your ideas on that.
My idea is that it will change nurses' minds who are thinking, I have to get out of nursing in order to live the life I want to live, and think I can still be a nurse and still have it all, like balance it all, family life, home life, whatever the case may be. I know this might not sound good if this is a hospital system listening to us, but maybe you don't have to pick up overtime, to pay off student loans, to pay your mortgage, to save for a trip, to take your kids to Disney, whatever, to even have children, that you can have another way to use your nursing skills without going to more school, taking on more debt, and still making money.
Right.
That was my biggest thing. Like as a mother, I truly and sadly was questioning it all. Like I went through all this nursing school. I paid all these loans. I did night shift. I did weekends. I sacrificed so much, and now I'm not going to be a nurse. I needed something that was way more flexible. And I think a lot of people have different scenarios that they'll resonate with that message and understand that there's finally a place where you can still be a nurse and make money without committing to shifts and 8 hours and 12 hours and weekends and holidays. You get to pick when you want to do those things. And I think
Absolutely.
that's really powerful.
And even to say, I know we all cringe and we say the health systems, but let's just be really honest, because I mean, I'm going to put it out there. If your nurses are burnt out and they're financially strapped and they're having to come to work to pick up overtime and you're just burning out your nurses further, shame on you. Because reality, you should be promoting this, because now your nurses have a chance to step away, take a breath, have control of their own schedule, their own mental health and sanity, while also taking care of their financial needs, that they may actually come back to work a little less burdened, a little less
100%.
stressed. So in reality, if there's any healthcare administration that needs to say anything about it, that's on you. Because in what these 3 gals have done is created a way to help nurses create some more income, because let's be real, some people are going to have their health insurance, but they need a little extra money. So they go out, they further their skills in the community, they have good attitudes, they go and they promote your hospital as, hey, you know what, this nurse really took care of me, I'm going to go to that hospital. I mean, if you're really smart out in healthcare, you should probably be partnering with these gals.
Well, in all
Jackie's
seriousness,
point, it's not nursing that they don't like, it's their environment, right? So they don't not like nursing, right? They don't like their environment. So this gives them the opportunity to do what they love in their own way, which I think for me was like huge for me. I was like, oh, this is great.
Absolutely. And this is coming from me who's not a nurse. She's seeing this from the other side. So take note.
And I have nurses in my family. You know, one of my best friends is a nurse. So like I grew up around healthcare and nurses and seeing that, you know, it's their passion. They love to do it. So if you give them a space where they can really enjoy it, to your point, like they're going to be happier just day in and day out.
Absolutely.
And Jana, like, you know, you're talking about hospitals and the overwhelm of hospitals. We look at the stress on the hospital system and all that. Talk about lowering readmission rates. When you get sent home and you have a chronic condition, or you're newly diabetic, or you're being told to sterilely change a dressing, and you're in over your head with instructions, or you are on your own, or Medicare, Medicaid just isn't getting you the home health aid that you need when you need it, we're supplying now a world of nurses that have these skills that are going to hopefully help keep patients at home. We don't need to be going back to the doctors, flooding the systems, clogging the wheels of the hospital if we don't have to. And if, you know, I know that my Saturday can be spent helping someone stay at home and recover better. Like as a nurse, I don't know. I feel like that's why I became what I did, right? So, you know, it really is not just for the nurses to not have to work overtime at the hospital, but also for the hospitals to be able to send their patients home and know like they're in good hands.
Absolutely. Happier nurses, healthier communities. I mean, how do you use?
We're gonna steal that, Logan.
Plastic surgeons love us. Yeah, those plastic surgeons love us.
Absolutely.
Totally.
That's amazing. Well, I want to let's wrap up some details here for our listeners out here. You are live in New York and in Florida. So if you are a registered nurse living in New York or Florida, not that you have a license, we don't want you in California if you can't come out here. So, but let's talk about, you are active. You can come on site and actually get going. Now, that doesn't mean if you're in any other state, they can still fill out a profile yet, and then when that state becomes live, they're going to let you know. And then you're going to start get your schedule. So why not be the first to go ahead and get signed up? Because I feel like it's going pretty quickly, because just a couple weeks ago, they were like, we're getting there. And then I got the live in Florida. So I filled out a profile. We're going to have some more details coming out on how to do that. And then in New York, get today. After you listen to this, it took me less than 15 minutes to enter my details, put in my credit card, boom, it was ready to go. It is that simple. So go ahead and get that done. You definitely want to get that done. Any questions that you have, there's no bots on your site, right? This is all live help coming to help. So
we are the bots. You are looking at it.
Now you've got actual real world help that's going to help you get, if you have any questions, if you need resources, whatever you need, the gals are going to help you out. So, you've got that there. And for patients, say you're a mom or grandma, or you're looking for some care for somebody, you're active as well in those states. You can go. Now, patients, can they sign up for profiles in other states as well? Or is it just nurses at this time? Can everybody sign up?
So any patient can come to visit the site, but they can only request care in the states that our nurses are in and we're live in. So if you live in Colorado as a patient, you can come and make a profile and explore, but you won't be able to hire a nurse yet because our nurses are in New York and Florida. So, you can go on, absolutely
but
explore.
Yeah, and that's all data that we're looking on the back end, right? Like the nurses that are coming in from other states, how many are there, right? So that's how we're also looking at where we open next and the patient population, right? So to Kat's point, if we have a bunch of patients that are signing up in Colorado, well, we're going to look into Colorado, and how many nurses we have there. So that's all part of our journey too, is the data and where they're coming from.
Absolutely. So if you guys hear that, if you want to get paid sooner and you want to have a
tell your friends.
Yeah, absolutely. Tell your
friends. Another big thing for why you should make a profile in advance from another state is that we are going to have our own little internal side gig for the nurses who have a completed profile in all states, where they're essentially doing what we're doing here live in New York, going in person to medical offices and clinics and outpatient centers to promote Nurse Connect, to bring patients to the platform. We're all going to work together. So that's going to be rolled out in the other states. So if you're a nurse that has a completed profile in a state we haven't opened yet, it's great to have it because you'll be the first contacted for our ambassador program where you work with us to grow this baby,
Yeah. Become the epic super user of Nurse Connect.
What a great opportunity. So I want to end this out, gals. I want to hear from you. Let's start with you, Kat. What do you hope that Nurse Connect what's the opportunity, what's the biggest change that you hope to see out there in the community from Nurse Connect?
Yeah, I think for me, it just kind of hits personally of there is this opportunity to kind of find that side hustle, that side gig that you've always wanted, that works with your flexibility and brings you opportunities. Home health care, I thought for a while, that's obviously just, elder care and nursing homes and all that. And it's so much more. There are so many individuals out there of all walks of life that need a nurse for a one-off visit or multiple visits. And Nurse Connect really can provide both the nurse and the patient with that solution.
Awesome. And how about you, Amanda?
So I think for me, it's really the access to care for the patients. I've been in healthcare for over 10 years, so I've seen both sides of it. I've worked with plenty of physicians, and I think this is just good for everybody, right? And I think we are really an extension of systems that are already in place and filling that gap. So to me, it's really the access to care while also leveraging our system to help systems that are already in place. So I'm happy to see that.
Awesome. Jackie?
To jump off a little bit of what Kat said, it's on the patient side, it's finally a place where anyone that isn't looking for elder care has a place to go. Postpartum care, fertility injections, post-op care, these things you can't go to an agency and say, hey, can you help me? They're like, do you have Medicare or Medicaid? No. So it's finally a place that breaks down the barriers for patients. And personally, it just offers so much flexibility. I can still be home with my kids. and still be a nurse when it works for me. And that's what we want for all nurses. It's definitely going to make you feel so much better as a nurse, less burnt out. And just being independent is great.
Yeah.
That's
like
amazing.
We're not hiring you. You're working for yourself, which is, you know, something Nurse Connect we really want to communicate is that this is independent. Like, you are not our employee. You have your own freedom and autonomy to go out there and practice as the nurse, LPN, CNA, HHA, whatever nursing scope you went to school to become.
That's awesome. Amanda, where can we find you? Where do the nurses go right now? When they hop up here, what's the site that they're going to?
nurseconnectnow.com. That is where they're going and completing their profile.
Yep. So guys, nurseconnectnow.com. Complete your profile. It is so quick. Wherever you are, if you're a nurse, go ahead. It's going to take less than 15 minutes. And if you're New York and Florida, get ready to work. If you're waiting for another state, hey, it's coming near to you soon. So girls, thank you so much for coming on today. I am so excited about this idea. I hope it spreads like a wildfire. I have no doubt that it will. What an amazing opportunity that you're giving not only the nurses in our communities, but the communities as a whole. This was a very holistic solution to a problem that we have been fighting for so long. And I think what you guys did, you saw the problem, you saw the need, you felt it. And instead of just sitting in it, you said, we're going to make a change. And what it's going to do, it's going to revolutionize nursing as a whole and our community as a whole. And I am so excited to be a part of it. So thank you for coming on today. It has been absolutely my pleasure. And I am so excited to see where Nurse Connect goes.
Thank you so much for having us.
This is awesome. Yeah.
And for believing in us.
Yeah.
Absolutely.
Yes.
Absolutely. Always a cheerleader for anything nursing. So great job. And to our listeners out there, thank you for joining us. If you have any questions, we're going to have lots of resources for you, how you can get in touch with them, how you can get set up. We'll guide you to all of those. And, you know, it's just a wonderful day to be a nurse. And now that Nurse Connect is here, it's even better. All right. Stay safe out there, guys. Bye-bye.